It is an honor to be here and to be with friends. And so thank you all for taking this time. When I put together this talk, I was asked to say for a broader audience, like what would you want to share with those who are in the mix and those who are at all stages of training. And so, or those who have finished their training, can we relate? So we're going to get started. And I welcome any questions, and we'll have time at the end. I'm going to set my timer so I keep to time. I have no disclosures that are relevant to today's talk, but I do want to thank the patients and their families who've allowed me to share their stories to, alliterate certain concepts. So when we think of these, they're not, mutually exclusive, right? There is the possibility that they will collide, and I hope to be able to bring that to you. So we're going to start with purpose. And forgive me for reading the definition, but I think it will help us set the stage. Purpose, a stable and generalized intention to accomplish something that is personally meaningful and at the same time leads to productive engagement with some aspect of the world beyond the self. So having purpose. Those who have purpose, have direction, have power, and they have a powerful motivator. Those who lack purpose have more stress, anxiety, and burnout. And when we look at the literature of going in, it was fun to read about all of these benefits of having purpose, such as stronger immune systems, faster recovery from surgery, more joyful, I mean, we all want some of that, and then find greater professional success. In Japan, there's a term for this purposeful living, and it's called ikigai, and really translates to basically, your reason for being. And I think the sweet spot is when we can find that interconnection and that intersection when we have something that our values connect with what we love and what we are good at. And that purposeful living is why we wake up in the morning. There's this book, it's a case study, and it talks about having ikigai in this group from Ijimi, right outside of Okinawa. And it describes how the men and women have longer lifespans because of this 10 habits that we'll go through. So ikigai, stay active, don't retire, take it slow. I think all of us know that this is a bit hard to do. Don't fill your stomach. I can tell you I've had some incredible meals since my arrival to California. And the interesting part about the don't fill your stomach is basically saying take about 80% of the food of your plate, leave 20 so that you can enjoy it. And the idea of just slowing down to enjoy your meal also probably means that you let yourself get full, and so you're not eating so much. But in the US, I don't know that we have that down too well. Surround yourself with good friends. I have done that just arriving in the last 24, 48 hours. Get in shape for your next birthday. Well, I got Jim Chang to thank for that from our ride yesterday. Smile. Reconnect with nature. Give thanks. Live in the moment and follow your ikigai. So pretty simple steps that maybe we can take one or two of these and think about that as we go forward today. In the US, there's a similar concept about starting with your why. Who is familiar with Simon Sinek? Many of you. So he has, well, now it's in the top 3, but his Start With Why on TED Talk is one of the top viewed. He was #1 for a very long time, but he's an ethnographer. And what that is someone who studies why people do what they do. And what he found is that those who were most successful, business, tech, medicine, in all aspects, if they started with why and then went to the how, the what was more purposeful. So for example, my why, I want to care and to improve the lives of patients with nerve injuries. How am I going to do that? Through evidence-based medicine, through innovative research. And what is the outcome? The outcome is I have patients with higher quality of life who can reanimate their limbs. But if I remember the why am I here? Why are we doing this? Do I have purpose? Then we can set everything else to make sense. So we're going to go back a little bit, and forgive me for telling my story, but I think the story can relate to what maybe some of you in your paths may. I grew up in Salem, Virginia. It's a very small town in the southwest corner, a little bit close, within 40 minutes of West Virginia. My father was an administrator at the VA hospital, and I would volunteer with him. And he was a social worker, and he would speak to physicians with such awe. Oh, here's my good friend, he's the chief of surgery, or who is this? So I was going to be a doctor from that experience. I had multiple knee surgeries, but still was able to play a Division I soccer at University of Richmond. And I wanted to be an orthopedic surgeon because of what Frank McHugh at UVA was able to reestablish in me, the ability, even despite 2 ACLs, that I could go and still play at a high level. So I was going to be an orthopedic surgeon, and my path, my purpose was clear. So I stayed on in Richmond at medical school. It was the Medical College of Virginia. Now it's Virginia Commonwealth University. And I applied to one school and got into one school. There was no way I was going to afford anything else. Really grateful for that opportunity. Went into orthopedics, a case, because that was what I was going to do. And it's amazing how one moment in time can change your entire direction. So I go into a case, and it was a hip replacement, and they brought out the slap hammer, and I said, nope, I'm not doing orthopedics. So it was that simple. And how crazy that one moment was like, I don't want to do that. And I didn't even look at other things in orthopedics. Fast forward now a couple of decades, here I am doing orthopedics a lot. But the reality of it is it's okay to have moments in time, and maybe you can think of some of yours, of where it was a change. And it was that moment that I was like, okay, I got to find something else. Met Carrie Canoon, who was a plastic surgeon. I went to his clinic, and I was thinking plastic surgery was all about facelifts and abdominoplasties, tummy tucks, 90210 kind of things. And what I found was, I was never going to be bored. One room was a cleft palate, and it was a breast reconstruction, a facial fracture, and it was all about anatomy. And I loved anatomy. So it was all about this purpose that aligned with what I loved. And so here it was, plastic surgery was my pathway. Carrie Canoon had trained with Susan McKinnon. He said, oh, you got to go train with her. She's one of these fabulous surgeons. And fortunate and gratitude and complete gratitude attitude, I was fortunate to match at Washington University. I wanted to have kids. And Susan McKinnon said, well, go into the lab and you can have babies. I was recently married. And I can tell you, I was pretty productive outside of the house. But I found my love of what, again, my future could be, nerve regeneration. How can we create models that show and demonstrate? And we use transgenic animals to watch nerve regeneration and to influence how that nerve can regenerate, or how can we stop it to keep from having painful neuromas. In this questioning, this scientific method, all of a sudden my path was a different direction, where the only reason I went into the lab was to be able to have babies and come out of it. And that too was successful. But I will tell you, this is the true purpose, right? Your family. So Jackson, who's in the middle, is 17. Zachary is 15, and sweet Caroline, I had in my chief year, and she is now 13 on Saturday. Went to Mayo Clinic, complimented the work that Susan McKinnon, who is, an internationally renowned nerve surgeon, here's the counterpart to that. So they always conflicted on stage, which was great because I got to witness both, and really set my stage going back to Washington University. At Washington University, it was all about being able to keep my lab going and focus on this purpose of really providing great care, be a good surgeon, say yes. And I was fortunate to meet these 3 different patients that I hope to utilize and illustrate their cases to maybe give a little bit of pearls that you can take with you. So Zach is a 27-year-old farmer, owned a farm. He was out working and saw one of these I don't know, tractors. He had a big name for it. I'm sorry, I don't remember it, but was smoking. So he, being the owner, knowing, okay, the fire extinguisher is on the on this said tractor, and so he jumped on it. What he didn't know was that it had gone through a live power wire and was completely electrified. So he suffered incredible electrical injuries. And I get a phone call from the burn center in Kansas. So I'm in St. Louis, Kansas, 6 hours away. And they said, we heard you may help us save this guy's arm. We've already taken his legs. He was near 80% burned. We've got all the other burns covered for him. He's really ready to go, just needs to save this arm. We're not a burn center at Washington University at that time. And I said, yes. I was like, I'm gonna take care of this patient. You know, it sounds like it may be a little over what we're all able to accomplish, but sure, I'm gonna take care of them. So he showed up in burn sepsis, immediately saw him, ushered him up to the ICU. And plastic surgeons, we don't, I mean, many of you I know are saving lives every day, like really life and death stuff. And I think I save lives, and this is my like little thing of quality of life, right? Like, it's okay, I got quality of life, which too may save them. But this was a moment where I actually contributed to and the whole team, that saving this kid's life. And so the privilege, the purpose of, I'm gonna take care of my patient, I'm gonna say yes. I believe that I have the power with the team that we could have, the ICU, our general surgeons, together we're gonna help save this gentleman. And we did. We started with a series of reconstructions, free tissue transfer, localized functional muscle transfers, skin grafting. It's the first time that I used allograft tendon to reconstruct finger tendons because he had no legs, to donut tendon, and he had no arms. So his other arm was okay, except that he had a radial palsy and no palmaris longus, which is what a tendon you would use. And what we found is like, okay, it works. And so here he was 3 years later, using that shoulder to do pull-ups, which I told him he should probably never do again. And he's expanded his family. And his mom wrote a book, Nothing Short of Life, and Nothing Short of a Miracle. And so I think that what we do matters and how we interact matters. And if we remember the why, I want to help patients, we say yes. I think when we're in this world of starting a new practice, you know, there's this whole balance of wellness. I hear you guys have this wellness survey. We have the wellness survey as well. And getting people to fill out a survey, fill out the survey for your chair. Let's do it. Really helps. Okay, got it, you got it. But truly, we're in this balance of wellness and wanting to say, keep your quality of life up. But you don't drive a career by saying no early on. You don't. And, you know, when you think about what do I regret? What I don't regret is my long hours working. I don't regret my nights and weekends writing paper, working on the lab, because it aligned with my purpose. And I'm very connected with my family. I'm still able to have a good quality of life. I'm still able to keep my working out so that I'm sane and I'm a happier person. But you have to say yes early on. Let's not forget that it takes hard work and no one's gonna do it for you. So there we go. So in the end, along with the clinical volume, I was still driven by this passion to improve patients with nerve injuries. And how did I do that? I did that by writing grants and making it matter. My career trajectory changed when I got my first grant. And that was through the Department of Defense. My whole family is military, my dad, my grandparents, my husband. So for me, my service was I was gonna give back to the Department of Defense. And it was interesting, that too was a decision, NIHK versus DOD. I wouldn't change it for the world. And I've been funded, thankfully, knock on wood, through the DOD over the last almost a decade. I'm so old. But that first grant, what did it do? It gave me independence from my mentor. It gave me time to do the work. And it validated me among my peers. And so that hard work and getting that first grant, it is a huge milestone. But once you have it, you got to remember how it feels to get it And then you have this continued purpose of like, okay, I'm going to sell my idea to you and you're going to want it. And that's all I keep thinking is positivity. And we'll get to that at the end. But it's literally the positivity that matters when you're writing grants, when you get the, okay, not now, or you don't even get, scored in your triage. Like, it is okay, because you got to remember your why, and that why will matter and take you through all of the failures till you get to the end. So really great. Oh, and the last thing to say is all of these smaller organizations and applying for a $10,000 grant, it matters. And I am so grateful because, and I believe, Dr. Chang is the reason I had one of them, but that started my, getting the pilot data, getting the affirmation of my team, getting the support, and being able to pay for help to get the work done. It really matters. And thinking about those small grants, they add up to something big. It can happen. I'm going to digress a little bit just because we are in a room of academic medicine right now, and just to talk a bit about, what are some key pearls that may help you if those who are interested in being a surgeon scientist. 9 surgeons have been awarded the Nobel Prize. 9 surgeons. So maybe you could say like, oh, that's not enough or enough, but there's 9 surgeons. I'll stick with that as a positive, and there could be more. And we should be the ones aligning with our PhD colleagues because we have access to the tissue. We know what the problem is, and we are the ones to make them relevant, right? But we also need them. Like, I am never going to put in and submit a grant as my sole PI because it doesn't work for me. I don't have the time to also do all of the other things. And by being together, we can be better, right? And so I think that these ideas of it is possible to be a surgeon scientist. It does require a few things. There's some obstacles. These may be pretty obvious. A lot of it comes down around funding. We have less funding. Departments of surgeries are getting less funding over time. The study section isn't composed of us. I don't have time to be on the study section except once a year. And that's what I commit to every year, one, because that's what I got. And so there's not us sitting at the table deciding, oh, this is important work. We also submit fewer grants than our PhD colleagues. I submit 1 or 2 a year. My PhD collaborator, every cycle he's putting in 2 or 3. Well, no wonder that he's going to have way more funding than me. And I align with him because he's a really good partner and he's very generous. But the debt and compensation, those who do surgeon scientists, you probably aren't going to make the same amount of money of those who are only 100% clinician. But I will tell you, if you relate back to your purpose, we make enough money, right? And you have to figure out what is it and how much is it? Because if my purpose is, I want to do innovative research, and I've tried, I mean, we've talked about it even this weekend of like, well, when are you going to give up the science? I've tried, but then I have the next idea. And then I'm like, I've got to know the answer. And so, and I'm not ready to give it up yet. I think it'll come in time when I have it to give to somebody who will also carry it through. But I do think it's hard, and it is a choice, and you got to think about that purpose. So things to consider, and this will go a little bit quicker, I promise. If you're going to choose to be a surgeon scientist, you have to identify a program that is also committed to that goal. At WashU, it sounded really great, but I was told as long as I keep my clinical productivity up, I can do research. It wasn't, oh, I'm protecting your time so you can be this great researcher. It was, if your clinical volume says okay, then I'll support the time. I got $25,000 a year for 3 years as my startup. My colleague had $350,000 a year for 3 years. I didn't know that. If you're negotiating a salary for a surgeon scientist, call me. I will happily help you negotiate that, because that really set the stage. Your environment truly matters. I now protect my surgeons 50%, and I really protect their time. And we map it out. We meet monthly. We talk about, okay, how are you balanced? Your RVUs are too high because you're in the OR too much because you've got to get the grant. You've got to have the time to do it. You need mentorships. And then, if you are doing research, I wiped out half of my loans by getting a loan repayment. And it was just telling them I was doing research. Yes, it's an application process, but it was important for my family. So keys to success, you want to be committed. Your clinical practice needs to align with your research question. If they don't align, you will not be successful. If you are driving your questions from what you're seeing in your clinic, in the OR, then you're going to know what you need to answer in the laboratory, in your clinical trial, who you're going to align with. But when they are disparate, you have a problem. And it's really interesting when you try to people to realign them. And when I'm talking to these junior faculty, like, keep it aligned and keep it simple. But capitalize on who you're seeing so that you can make it. Now, I don't need to tell anybody about this, but efficiency matters. You have to know and chunk out your time. I'm a big chunker. Okay, I'm going to give 3 hours to this grant, and then I'm going to turn it off and move to 3 hours of email. And okay, I'm going to make all those phone calls at 4 hours on Friday afternoon. Chunk your time. Be efficient. You will feel better versus the procrastinator that my 17-year-old is right now. Ah, girl. But, I like to procrastinate too by reading and trying to do something that gives me fills. And then I say I'm chunking it. I'm going to read for 2 hours and enjoy this book. And then I'm going to put it away and get the work done. So it is okay to remain human despite trying to keep yourself managed. And then the next group all comes about people. And so this is where we're going to move to where the people matter. So the power of people. Woody Hayes is a huge previous football coach. I mean, he a god in Columbus. If you haven't heard of anything about the Ohio State, is they are fiercely, fiercely committed to their athletics. So Woody had says, you win with people. And I 100% believe that. These photos are of the people who helped me be successful. My first assistant, Teresa, my scrub nurse, who is, old and slow, but man, she cared about getting it right every time I showed up to the OR, right? The teams, many of you probably see this. I have all these international people coming to watch and learn. You have your fellows, you have your mentors. The people in your lives matter. Don't forget to thank them. I did this thing and I actually really love it. It's #gratitude attitude. And it came about in November. I had a visiting professor from England who was just joining us for a couple of weeks to learn what I do. And she's like, oh, we have, Thankful Thursdays. And I just started in November. And I was like, oh, the Thanksgiving, right? So we started it with, I am thankful for, and I put something down and I was like, start it up. And by the end of the day, my entire department from all aspects had something they were thankful for. And it was so empowering. Thank the people around you. Thank the people who are working for you. And remember, they're working with you with a purpose to take care of the patient that's on the table, your clinic patients coming into, not to torture you, but because they need your help. People matter, and how you make them feel matters. In academic medicine and private practice, wherever it is, the development of specialized teams is important. So here in 2002, John Maxwell came out with, teamwork makes the dream work, the laws of teamwork, and he really came to these 10 things of C's: commitment, contributions that make a difference. You've got to be competent. We all are. We're smart people. Communication. I think when I, as a chair now, deal with the problems, it's about a miscommunication. I used to jump on every time when someone would call me, oh yeah, that's great. And then I find the other side of the story. So now I don't react. Now I think, okay, I'm going to look into that. Tell me your story. Okay, great. I'm going to find the other side. Communication and how you communicate. If you can learn and work on anything, remember that. Remember, there's always a reason why someone is behaving in a way that you may not agree with, right? You've got to communicate. Cooperate, chemistry, that personaling, we can't control that in medicine. We love that there's very diverse there. Creativity, conflict management, cohesiveness, and community. Building a community. I talked about my values when I came to Ohio State, and I said, we will work together through open communication, transparency, and respect for all. If you asked any one of my faculty, any one of my residents, they will be able to know that our values are. It's very simple. Open communication, transparency, and respect for all. And when we think about teamwork makes the dream work, right? Dream. It defines beyond professional output or success, bigger goals and ambition. Dream is also purpose, right? Your team can fulfill the desires of your heart, John Maxwell. So when we think about where we are and what we're trying to do and the intersection between purpose and people, it is here. How do you succeed, like the nuts and bolts as well? I had great teams in the clinical world, people who were wanting to work with me, not for me, and really good teams in the research world. And having both of those allowed us to be very successful. And it's all of these things at some level, and some of them times we have them, sometimes we don't. But together, this is what makes my dream work. Mentorship, sponsorship, and advocates, this is not a talk about it, but there is a difference. Mentorship is there for a long term and influences your growth. Sponsorship is a single moment in time where someone with some influence can put you into a place. Jim Chang has been an incredible sponsor for me, sponsored me to be one of the program chairs for the residency in our national society. He was my board examiner, which literally left me in tears at the end, but in the same thing, I still passed. Thank you, Jim. But sponsorship and the ability to sponsor for those who have a little more time as in a career, think about your influence and help those around you. There was a good study out of Hopkins, and what they looked at, these themes about mentorship versus sponsorship. Academic careers were, it was a requirement to have sponsorship way more than mentorship. And unfortunately, women, we don't ask, right? There's a whole book about it. Women don't ask. But we're less likely to seek that. And so if you are in a position, make sure that whether you're the one looking for it, don't be afraid to ask. If you're the one who has the power in that space, don't be afraid to use it for good. Remember the purpose, right? Why we're here. My mentors and sponsors are many, and they look very different. And depending on which part of my career, depending on which aspect of it, there's men and there's women, and I'm grateful for all of them. And there's probably many more who are not even listed here. But I would tell you that #gratitude attitude every day to the people. The people matter. Alex Shin, Mayo Clinic, good friend of mine. I was in the operating room with a hard case, and I needed someone to answer the phone so I could talk it through. I called Alex, he answered the phone, and we talked through this free functional muscle that the guy had done a dunking, and he ripped his tendons. And when I got there, he ripped the tendon out of the muscle, not the tendon out of the tendons. And I was like, oh gosh, what do I do now? And in the end, like the guy that was dunking is fine. But it brought us to talk about the surgical lifeline. And that was in your way as you're training or in your idea of if you're a mentor or a sponsor, answer the phone or find the person who no matter what, no matter how far you are, who will answer the phone. And I think this is like an editorial, but I will promise you, Alex Shin answers the phone. Collaborators with generic spirit is super important. These are my PhD researchers who have greatly influenced my research career. As a surgeon scientist, we always are criticized for being too busy, not showing up. If you take research as part of your job, right? If you've protected time and use that time not to build more RVUs to get a bigger bonus, recognize that PhD can be an incredible ally, but they only have so much to give. You have to show up. It has to be two ways. You have to provide more than just the funding for them to do the work. You have to consider it and show up and deliver. And then the world is your entire like candy store. So this is my most recent clinical trial. It started with looking at, with Matthew Wood, looking at a device that helps grow nerves faster. We did this, we figured out like on animal models, and then took it, so we had funding for the animal models, and then we brought it into, and now recently I'm finishing the last 2 years of our clinical trial, which again, is one of those things where it took not me, but me with a team of people to really be able to influence my purpose of improving patients' lives who have nerve injuries. If we can make it grow faster and more efficient, let's go. The last part of people is where it interconnects, where people and purpose matter, and that is your family. I am forever grateful that my significant other, Jeff, has stuck with me through the craziest time. He was my lifeline to be truth. He was the one who's telling me, this is too much for us. We never see you. You've got to come home. This is enough to say, this is not what I signed up for. He's a businessman. He's 12 years older than me. He's been more successful than I've ever been. And I will tell you, he gave up a lot with me, with us, for us. And it wasn't until we had stable childcare that we actually could both really enjoy each other and enjoy our family. So I always volunteered when I was in residency because my entire salary went to paying for an au pair. And the au pairs gave stability to us. And here are my babes now. They're all about their posing. My men, they want to take their shirts off as soon as they can. It's often you won't even find them with pants on when they're in my house. They're in their little like skivvies walking around, and it's like beautiful boys, right? You're just so grateful, right? That I have and been able to maintain my marriage, but also a very robust family life. It's truly what matters. So when we think about it from a patient standpoint, where purpose and people collide is with Brandon. So Brandon was a healthy 6-year-old boy at the time. He got a common flu and ended up having this flu called acute flaccid myelitis attack his spinal cord. Now, this was really big in 2016 and 18. Since COVID, I've only treated a few patients. But in 2014, it was finally recognized by the CDC. There's about only 800 cases that have been diagnosed in the country and less than 1,000 worldwide. And there are healthy kids who get this enterovirus, common cold, and knocks out their spinal cord. And there's no rhyme or reason. We haven't figured it out. And they have flaccid paralysis of their upper extremities. It looks just like polio, but they haven't been able to harvest the polio virus. So it's not polio, it's polio-like. And many involve the lower extremities. So in my nerve world, I focused on brachial plexus, and I focused because others were doing it at WashU. I was like, well, I was told I can really work on lower extremity nerves. No one had really delved into that, and that's a talk that I'm going to have later tonight, excuse me, about these nerve transfers. But nerve transfers are pretty simple. It's rewiring the nerves, rewire what is working to what is not working. And I got the opportunity to test this in adults and figuring out, okay, well, nerves in the lower extremity rewire just like in the upper extremity, but no one has just delved into it. And so because of the patients that I had, the population that I was able to treat, this is an area that I really launched a big career on, going around the world talking about how we can restore animation to the leg with these little nerve rewirings. Well, okay, so take that as fact. And then you take about my relationships with people, and I'm doing these nerve transfers for adults. And at the Shrine, Scott Cozen and Dan Zotolo are seeing in Philadelphia patients with AFM. All of these kids who have, barely can hold their necks, right? Because everything centrally has been paralyzed, but their hands work and their toes and feet work. And so Dan calls me up, Scott's on the line. Amy, we have these patients and they have lower extremity involvement. More than a quarter have lower extremity involvement. And they're like, well, what can you do about it? And I was like, oh, I've got all these great ideas. I really wanted to use the sciatic nerve. If his toes are moving, we can take fascicles of the sciatic nerve. We can get into the nerve. Always wanted to do this nerve transfer, didn't have a reason to do it. And I was like, oh, it's going to be so great. You guys can do it. He's like, great. They're coming to see you. It's really different when you have an idea than when the person's in your office. And so then it was, we had never known at that time, do nerve transfers even work in this diagnosis? And I'm creating nerve transfers that had never been. They weren't these that I had gotten comfortable with. They didn't have this as an option. And so this is where your people, my relationship with others, the idea of saying yes, saying yes, knowing my purpose was, well, if we did nothing, we know there was nothing that's going to get better. And so through that need, aligned with my purpose, through that need, I designed these cool nerve transfers that who would have thought would work. I put them in the cadaver. Yes, it works. I started them on these children with all of the hoopla. I started with 10 patients. This was what working with our IRB was, because it wasn't experimental. We knew nerve transfers work, but it was still like a vulnerable population to try something new. And it worked. And so now Brandon, who is many years into it, is only in his wheelchair to play basketball. I have operated on over 77 patients, of that 1,000. I've evaluated over 200. And of the cohorts that I have trained and have looked at, we have more walking who were in wheelchairs, and all have improved without any complication or deficit to date. And I can tell you, when I keep that purpose aligned with the people and humans and what can I do to help you, you can get great things. Where my purpose has changed was in 2019, when I became the department chair of these wonderful people. And I think the purpose now is I want to lead and develop and provide the resources, remove the obstacles for the future and success of my people. And that's what gives me my purpose these days. So positivity, and I promise we're almost done. Positivity matters. So here we are, Norman Vincent Peale. Okay, self-help book, Christian. I was looking and researching about positive thinking, and it started here in the 1980s. Norman Vincent Peale was talking about positive thinking. And again, forgive me for reading it, but to become more confident, always carry inside your mind an image of yourself as successful. Once you visualize it, you manifest it. Replace all the negative thoughts you have about yourself with positive ones. It's pretty good advice. Like it. When you get your first grant, remember how it feels, put it back in the universe. That's how it's going to feel again. That's your drive, right? Take care of your body by exercising, maybe not the old Lahanda, eating nutritious foods, and sleeping well, because those lifestyle factors greatly determine your energy levels. Okay, sounds a little bit about Ikigai, right? Find what you love to do. When you're doing things that you genuinely do not enjoy, you will always feel like you lack the energy. I mean, let's talk about that, rounding in the morning. Sometimes we're drained. But when you find something you love, you lose yourself in it. And so these principles, although it was Christian self-help, it is throughout this entire book of just this idea, if you can be positive, what will that bring you? But something like joy. And here, there's more within the medical literature about being positive. My good friend, who is 42 years old, was diagnosed with pancreatic cancer about, 6 months ago. And I just was like, had just, was looking and doing the research for this talk. And I was like, well, we're being positive. We're going to be positive. You're going to fight this. And knock on wood, they got all the cancer out, and it was done through a robot. Like, hello, you guys do this, right? And who knows what that will take, but the positivity matters. And I really, truly think there was no chance of it not working in our minds. So if we increase our optimism, we potentially can increase our mortality or decrease our mortality risk. Who knows? So thinking of how can we do it and why we should do it, these are things, right? This matters to us as surgeons. to us as scientists. I want to be happier, right? That's great, right? Let's think about being positive. So here's Cash. This is my last one. So Cash is a 15-year-old. He was working with his parents. They're part of the gypsy community. So I'll let you take that where you want. It's something very new for me. But he was working when a hot asphalt opened up onto him. He was seen at an outside hospital. They called us and said, hey, can you plan on doing a hemicorpectomy? That means 15-year-old taking off to save his life. And what did I say? I had to get my orthopedic surgeons, my vascular surgeons, the trauma surgeons, and I said yes. Power of people, purpose, and positivity. So I was determined. Well, let me start even back. So the patient arrives. This is this first picture that we see. For those of you in the audience may know that the femoral arteries are right there and exposed, ready to go. It looks nasty, right? And so I think of this, and I've been doing all this research with Walter Reed about amputations, and these look like the pictures that were there. So I call my good friend, Scott Tintle at Walter Reed. He gets me in touch with Kyle Potter, who's the head of orthopedic trauma, who deals with this all the time on field. And he's like, okay, Amy, you've got to get those vessels covered. You've got to get, control of those vessels. They're going to blow out. That will save his life. And then you're going to put him in a hemivac of all of his entire body. And you're going to slowly work this and you can save him. You can save his legs. And I was like, okay, I'm going to have to get a lot of people on board. But that's what we did. And it was the collaboration of plastic surgeons, orthopedic surgeons, the general surgeons. I mean, if you could ever have a purpose and us being positive that we can save this kid, this is what it came to. And that's where they all collide. So over time, with muscle flaps, with skin grafting, Integra really loves me because I put Integra down first. And then we got a blowout of his stoma and we lost it all. So like $100,000 worth of Integra went to the back. But that's okay. We did it again, as you can see. And we just slowly worked to save this kid's legs. And we still have work to do. But when I left WashU, they came that last day. And it was an incredible thing, right? The power of purpose, power of people, and positivity. So how do we get it? I think it's pretty much, these are options being positive. When we think about our rules of Ikigai, it matters. I love this quote that I just saw on Instagram. I'm such an Instagram hacker right now. Staying positive doesn't mean you have to be happy all the time. It means that even on hard days, you know that there are better ones coming. Boom, right? That may be all it takes when I'm tired, I've been up all night, and I have my clinic facing me. Like, it may be all it takes. And another thing that I really talk about is choosing joy. We say that, but if we think about choosing happiness, it doesn't really work. Happiness comes from happenstance, which is directly associated with circumstance. Joy is more than that. It's a state of being. So choose joy. Don't just search for happiness. Choose joy. I think it matters. And I'm going to leave you with this last quote. Success is no accident. It is hard work, perseverance, learning, studying, sacrifice, and most of all, love of what you are doing or learning to do. Pele, one of the best soccer players of all time. Thank you.